Have you ever stepped out of the shower and suddenly felt dizzy, your head spinning, your heart beating a little faster, only to brush it off by thinking, maybe I'm just getting older? But what if I told you that one of the most ordinary daily habits, something you do without a second thought, could actually be quietly increasing your risk of stroke? It may sound unbelievable, but for many older adults, seemingly harmless bathroom routines can have a powerful impact on the brain and heart. Picture this, it's late at night. The house is silent. You're getting ready for bed, and a warm shower feels like the perfect way to relax. Or it's early morning, and a refreshing stream of water helps wake you up. These moments feel comforting, safe, familiar. Yet within them lies a risk doctors have warned about for years, especially for people over the age of 60. In this episode, we'll reveal 7 dangerous shower habits that can quietly raise your stroke risk, often without any warning signs. Some of them may surprise you because they feel so normal, so routine, that we never question them until something serious happens. If you've ever wondered whether your shower habits are truly safe, type 1 in the comments. If you've never thought about it before, type 0. And don't forget to subscribe to Health 365, because your health deserves care and attention every single day. Now, let's begin with the first habit, one that may already be putting your health at risk. Crescent Moon Part 2, Late Night Showers, a sudden alarm for your blood vessels. After a long day, a late night shower feels like the perfect way to unwind. But for older adults, this habit can quietly turn dangerous. As night falls, outdoor temperatures drop, and so does your body's core temperature. When we're young, our blood vessels adapt quickly, expanding and contracting smoothly to keep circulation stable. But after 60, arteries lose elasticity. They become stiffer, more fragile, and far less capable of handling sudden changes. Stepping into a cold bathroom late at night can cause blood vessels to constrict abruptly. This limits blood flow to the brain and heart, dramatically increasing stroke risk. Doctors explain it simply: when the body cools suddenly, blood vessels behave like old plumbing, rigid and brittle. Instead of adjusting gradually, they clamp down. Blood pressure can spike or circulation can suddenly drop within minutes. I once treated a 70-year-old man from Ohio who had showered at midnight for years, believing it helped him sleep better. One cold night, he stepped out of the bathroom and told his wife he felt dizzy. Minutes later, he collapsed on the couch. Scans confirmed a stroke. Doctors identified sudden vascular constriction from late-night showering as a major trigger. His family was stunned, because the habit had seemed harmless for decades. How to protect yourself. Avoid showering too late at night. If you prefer evening showers, take them earlier, before nighttime temperatures drop sharply. Warm the bathroom before entering. Let hot water run for a few minutes or use a small space heater. Most importantly, listen to your body. If you feel chilled, dizzy, or your heart races, stop immediately and rest. Staying healthy doesn't mean giving up comfort. It means adjusting habits so they truly support your heart and brain. Ice Cube Part 3, Cold Morning Showers, Sudden Shock to the Heart. Many people swear by cold morning showers, believing they boost energy and mental clarity. But for older adults, that icy jolt can place enormous stress on the heart and brain. The moment cold water hits your skin, blood vessels constrict violently. This forces the heart to pump harder through narrowed arteries. For someone in their 60s or 70s, this sudden strain may be too much. Think of it like forcing high-pressure water through an old, rigid pipe. Pressure builds fast, flow becomes unstable, and blockages or ruptures can occur. In the body, this means sudden blood pressure spikes, and sometimes dangerous clots traveling to the brain. I'll never forget my neighbor, Mr. Harris. He was 70, fit, independent, and eager to try health trends. After reading about cold showers, he started using ice-cold water every morning. For weeks, he felt energized, until one morning he collapsed on his porch after showering. Doctors confirmed a stroke. The shock to his aging blood vessels was simply too severe. A safer option. Start with warm water. If you enjoy cooler temperatures, slowly lower the water at the very end, allowing your body time to adjust. If you have high blood pressure or heart disease, avoid cold showers entirely. Protecting your health isn't about discomfort, it's about wise daily choices. Fire Part 4, Overheating and Long Soaks, a Silent Circulation Crisis. Long, hot baths feel wonderfully relaxing. But for older adults, staying in overheated water too long can be dangerous. Heat causes blood vessels to dilate. While that sounds harmless, excessive dilation can cause blood pressure to drop too quickly, reducing blood supply to the brain and heart. Slower circulation also increases the risk of clot formation. If a clot blocks blood flow to the brain, a stroke can occur. My brother, nearly 70, learned this the hard way. After gardening, he loved soaking in hot water for over 30 minutes. One night, when he stood up, he became dizzy and collapsed. Doctors explained that the combination of vessel dilation and low blood pressure nearly caused a stroke. Stay safe. Limit hot baths or showers to 10 to 15 minutes. Keep water warm, not scalding. If dizziness or rapid heartbeat occurs, get out immediately. If you have heart or blood pressure issues, consult your doctor before making hot baths a routine. Part 5, Skipping hydration when blood becomes too thick. Most people don't think to drink water before showering. But mild dehydration can significantly increase stroke risk, especially in older adults. When dehydrated, blood thickens and flows more slowly, increasing clot risk. With age, thirst signals weaken. Many seniors don't realize they're dehydrated until warm steam causes mild sweating and worsens the problem. My 68-year-old aunt once became dizzy stepping out of the shower. Doctors told her dehydration had thickened her blood too much. Now she drinks a glass of water 15 to 20 minutes before showering, and the dizziness disappeared. Clear advice. Drink a glass of water at least 15 minutes before bathing. This simple habit powerfully protects your brain and heart. Face with thermometer Part 6, Showering while unwell, ignoring the body's warning signs. Many people shower to feel better when they're dizzy or tired. But for older adults, bathing while unwell can push the body past its limits. Dizziness, headaches, or weakness may already signal poor circulation or rising blood pressure. Sudden temperature changes in the shower add dangerous strain. A neighbor of mine, Mrs. Jenkins, 65, had mild headaches. One afternoon, she took a hot shower and collapsed. Doctors diagnosed a mild stroke. The headache had been a warning sign. Strong advice. If you feel dizzy, unusually tired, or develop sudden headaches, do not shower. Rest. Hydrate. Call your doctor if symptoms persist. The shower can wait. Your health cannot. Flex biceps Part 7, Showering immediately after exercise, a circulatory tug-of-war. After exercise, jumping straight into the shower feels refreshing, but it can be risky. Exercise dilates blood vessels and causes fluid loss through sweat. Adding hot water can make blood pressure drop suddenly, starving the brain of oxygen. A cousin of mine nearly collapsed after showering immediately post-run without drinking water. Safer practice. Wait 15 to 20 minutes after exercise. Sit, hydrate, and let your heart rate stabilize before bathing. That short pause can prevent a life-threatening event. Fork and knife with plate Part 8, Showering after meals or medication, starving the brain of blood. After eating, blood shifts toward digestion. A hot shower pulls blood toward the skin, leaving less for the brain. Doctors describe this as a tug-of-war. Digestion pulls one way. Heat pulls another. The brain loses. A friend's father, 65, took blood pressure medication after lunch and showered immediately. He collapsed and suffered a mild stroke. Simple fix. Wait 30 to 60 minutes after eating or taking medication before showering. Patience protects your brain. Sparkle's summary, Small Habits, Big Safety. We've explored 7 hidden shower dangers and how small adjustments, hydration, timing, temperature, can dramatically reduce stroke risk. Health isn't built on dramatic changes, but on thoughtful daily choices. Now ask yourself, which habit will I change today?